I have a number of patients, diabetics, and I'm talking about juvenile onset or early onset type 2 diabetics who have been fit and exercised a lifetime, Harry. They're trim and fit, and they've been taking insulin their whole lives. And in some of these people, I know what their coronary arteries look like. They're fantastic. It's amazing. Because the old saw in cardiology was, well, if you had that, you had coronary disease. No, they don't. Not necessarily. I think that regular exercise is underappreciated. I think regular exercise is more of a plus than smoking is a minus. Now, don't get me wrong. Of course, we're 100% against smoking, but people underestimate a good fitness program in terms of mortality reduction.
Hello, everyone, and welcome to Finding Your Wellness, a podcast sponsored by the Columbia Association. I'm Dr. Harry Oken, a community physician for over 37 years and the medical director for the Columbia Association. I am proud to be working with Columbia Association for over a decade to help assist in their mission to improve the health and wellness of our community. Today, you're going to meet my guest, Dr. Ron Schechter, and we'll be talking about a special type of exercise known as Zone 2 training. But let me first tell you about Dr. Schechter. He's an old, close friend. We met way back in 1973 as freshmen at the University of Maryland in College Park, and our careers have paralleled in many ways. After we both graduated in 1976, both majoring in zoology, we began our master's program at College Park at Maryland. Ron in physiology and myself in parasitology and microbiology. We were teaching assistants together in chemistry and zoology, and that's when we honed our tennis skills, often having blistering matches in the summer heat. We then proceeded to medical school. I stayed at the University of Maryland for my residency training in internal medicine, while Ron went to Temple in Philadelphia. He returned and then did his cardiology fellowship at the University of Maryland, and then has had a very busy, successful practice as a clinical cardiologist in Baltimore. Throughout Ron's career, he's kept himself fit. He runs, he does skiing, and a whole variety of other things. And he's taught and inspired his patients to do the same. Together today, we're going to discuss Zone 2 training, a method of keeping your heart rate in Zone 2, which we'll explain. And that's where you exercise aerobically. This training technique can have a great influence on your endurance, promote improvement in your cardiovascular vitality, and even help you age more gracefully. So Ron, it's great to have you here. Let me ask you first, make a couple of comments about Zone 2 training. I know you Zone 2 train.
Yeah, there's a lot to discuss, and you and I talk about this all the time. And I would say, as maybe a bit of a teaser to our listeners, Zone 2 training can save your life. Zone 2 training can certainly improve your overall health and well-being in a variety of ways. And Zone 2 training is just not that hard to do.
Yeah, I agree. You know that saying, train slow to run fast?
Yes.
You know, and that's what Zone 2 training does. The more you do it, the better you get, the more efficient you are. How often do you do it?
Well, my goal is 4 times a week. My achieve is probably 3 times a week. Mm-hmm. And, I would also point out, because I think it may surprise a lot of people, that the greatest athletes in the world, and I'm talking about the high-end elite endurance athletes, guess what they do? Zone 2 training. Guess how much? 80% of their cardiopulmonary training, Zone 2. So if they can do it, we ought to do it.
Right. Well, let's talk about the different zones. It goes Zone 1 to 5. How would you explain it to a layperson about these different zones?
Sure. So Zone 1 is recovery. It's what we're doing right now. We're sitting around doing nothing, or we're walking around in our usual activities of daily living. It's not climbing stairs. It's the normal thing we do all day that is not exercise. Zone 2 is the next level up. We're putting a little more stress on our heart, and we are building endurance in Zone 2. And we can talk about heart rates going up in Zone 2. It is, as you mentioned, an aerobic conditioning. Zone 3, Zone 4, Zone 5 are higher levels of intensity. Zone 5 being what we call high intensity training. Basically, you're going full out as hard as you can for 1 to 3 minutes, and you can't go any further. So that would be 5. We want to focus on zone 2 because you get the most bang for your buck.
So the zone 2 training is dependent on your age and your current fitness. And there are a lot of different equations that you can predict what heart rate you should be at. How do you see that?
The first point I would make is that anybody can do zone 2 training and should. For instance, we have somebody that's been exercising for a lifetime like you. Well, you should be in zone 2. But what you're doing in zone 2 is going to be a different pace, perhaps a different exercise than what someone that is just starting out and says, I really have some deconditioning. I'm not where I want to be in my fitness. Fine. That person might be walking with a modest pace and be in zone 2. A highly conditioned athlete might need to be running at a 10-minute mile to be in zone 2. Doesn't matter. Both are getting the same benefit of zone 2. So it doesn't matter where you are, you can do zone 2 exercise.
And so roughly for the person who's just starting, not somebody who's been an athlete, you would say that old equation, 220 minus your age times 0.75 would probably be where they should probably look for, right?
Look, I think that's reasonable. That's not what I recommend. If you're into numbers and you want to say, gee, I really want to monitor my heart rate, and I'm sort of into that semi-geeky stuff, fine by me. Harry, I really recommend your level of perceived exertion. You can tell when you're in zone 2 very easily. You don't need a piece of equipment. If you or I or a more or less conditioned person is in zone 2, they are feeling the same thing.
Yeah. And actually, the way I do it, I sometimes use a heart rate monitor, but more often, I just go out. If I'm going out for a run, I just want to make sure I'm only breathing through my nose. So if I can just only breathe through my nose and I'm not that highly exerted, that's probably my zone 2, correct?
I like that. A couple of ones that work for me and I teach my patients would be, I can talk to you. I can't talk to you nearly as comfortably as I'm talking to you now. I'm going to have a little bit of huffing and puffing. If you're listening to me on the phone and I'm doing a zone 2 exercise on a bike or on you'll know I'm exercising. It won't be my favorite conversation. I'll be breathing noticeably. I won't be sucking wind. I won't be in any pain. I'll be comfortable, but you can tell. Too often, I think people need to pick it up just a little bit. We want to be comfortable, but not that comfortable in zone 2.
And so zone 2, light exercise, is when the body is burning fat for energy and it has all the available oxygen it needs.
Oxidative phosphorylation, Harry. We learned it in biochem. Yes, sir. You got plenty of oxygen.
Plenty of oxygen, and you're not going to get into an oxygen deficit, and there's not going to be any buildup of lactic acid, which makes your muscles burn.
Precisely. Right. This is not feeling the burn. If you're feeling the burn, you're not a stage 2, and we want you in stage 2.
Right. The other thing that you and I are both aware of is high intensity interval training, which is a different condition, right? Which is where we're really going into stage 5 or 4 or 5. In that situation, we're going to feel the burn and we're not going to be able to sustain it for very long. And that does something different to us. So we want to be a couple times a week, 3 or 4 times a week into stage 2, and we're going to have a big effect on our mitochondria. Mitochondria will be more flexible. It might stimulate better mitochondrial health, which is really related to how we age and how we feel.
Look, I agree. There's a lot to the mitochondria. And I think of it as this, if you want to get down to the organelle level, to even the cellular level, we are stressing our capillaries. Our muscles are asking for more blood flow. They've got adequate oxygen because we're not pushing our level too hard. And those capillaries that are providing that blood to our muscles and our brains, by the way, are opening up. They are getting bigger and stronger and better, and they are providing those mitochondria, those powerhouses, more blood so they can do more and better work and more efficiency. And it's as if they learn, Harry. It's as if your mitochondria are getting better and healthier. And we think that's what's translating into the undeniable health benefits. It makes you live longer.
I agree. And there's really a lower risk of injury when you do zone two.
Agreed. I think, for us middle-aged and beyond people, well, listen, if the elite athletes of the world can do zone two is where it's at. I'll tell you a little secret that Dr. Oken likes his high intensity training, but I would tell everyone, beware. That's where people get hurt.
Yeah. I think the value of high intensity interval training, in my opinion, is once or twice a week, no more, really getting into those white fibers that don't have much of a blood supply. That's why they're white, breaking them a little bit at the microscopic level and sending a signal to your brain to get a growth hormone release. But that's not what we're doing in zone two. We're doing something different in zone two. And as you said, I liked what you said about, these high level exercisers who are really understanding the science of exercise. Not that you have to, but they're really understanding it. I mean, they're doing 80% of their training in zone two.
Yeah, it's remarkable.
Yeah. And what happens is over time with these individuals, they're really having an effect on the number of mitochondria that they have. That's the powerhouse of the cell. They're increasing their mitochondrial efficiency. They're actually lowering the resting heart rate as they get more and more into it, which is a nice thing. Yes. With that, the blood pressure decreases. I think also from a metabolic standpoint, it has an effect on insulin resistance, right?
Oh, there's no question about it. There's just no doubt about it. And that I think is tremendously important. I mean, we can sort of tout the virtues of zone two exercise. In addition to what you already said, it's going to build your aerobic fitness. It's going to build your endurance. And don't worry about where you start. You don't have to be a big time exerciser. You start where you live. You start where you are physiologically, and you will get better. And your zone two will change over time, and that's great. You will go further and faster as you build your zone two endurance. You will reduce your risk of injury. I agree. Fatigue is improved. It doesn't beat you up. The mitochondrial boost you already mentioned, we are burning fat. Everybody likes that idea. Your cardiovascular health will definitely improve. And I mean pulmonary health as well. Insulin resistance you mentioned. These are all great things. And I really think it translates into longevity and overall well-being. Something I think a lot more about than me, but it's a little bit interesting, is that it seems like these mitochondria have a little something to do with cancer prevention. And we talk about this programmed cell death. We don't want to get too deep into this, but mitochondria seem to be very important in our bodies in getting rid of bad cells or senescent cells.
I agree. So if you're starting a program into zone two, once you start, how long do you suggest people stay in zone two?
I think, first of all, longer is better. So, if you're reasonably into exercise, and our listeners may want to sit down for this, I would say 90 minutes a week is low end. As a cardiologist, I'll tell you, the American Heart Association, we want 150 minutes a week. Now, Harry, you don't have to do it all at once. You got 7 days, 150 minutes. You can do the math. Start with a few sessions. If you're a real newbie, start with 10-minute sessions, fine. But you really, really want to get yourself moved up till you can do a 30-minute session of whatever. Walking with pace is fine. Riding the bike is fine. Swimming at a modest pace is fine. You name it. But you really want to get to that 30-minute. I prefer 40 to 45. But if my patients can give me 30 minutes 3 times a week, I say, give yourself a pat on the back. You are on the way, and build up from there. I would rather see them do multiple sessions of 30 minutes than say, well, Dr. Schechter, I went out and did an hour and a half on Sunday. Am I done for the week?
Well, I think you and I have also talked about this, is that everybody ought to have an exercise program, right? Yes. What's your program, right? I'm always talking to people about, don't do the same thing over and over again. Make sure you're, particularly as you age, you do some resistance exercise, working with weights. Don't forget about flexibility. Don't forget about balance. All these things are so important. But a lot of people who train hard, they actually overtrain. You've probably seen this, and it can have significant cardiovascular consequences, right?
Well, no question about that. We can overtrain, although I think those are at the extremes. I mean, people running marathons, if you're not an elite athlete, Harry, you know my feeling about that. Don't run marathons.
Right.
I would say this about zone 2 training. Although I finished saying that it's easy, here's what's hard for, I think, a lot of us. We tend to overdo. You got to get yourself in zone 2 and stay there. I think for a lot of people, certainly myself included, I tend to start pushing a little more and a little more because you're feeling pretty good in zone 2. And you say, gee, am I really getting a good workout? The answer is you are. Keep that steady, comfortable pace, maintain an even strain. If you feel yourself pushing it, throttle back. That's not what you want to do. You want to stay in zone 2 for a long time.
Yeah, that is a challenge for people who are feeling good and then they go, okay, I'm going to push it. Now, what I sometimes do, I'll keep it at zone 2. And at the very end, the very, very end, I might do a couple of bursts. Okay. That's just my nature. And I think that that's okay. But you really, to get the value on your mitochondria, you probably want to build up to a 45-minute zone 2, which means, you're going to go slow. And a lot of people have trouble, putting the reins on that.
Yeah.
But getting back to overtraining, one thing I heard you comment on this, and I think this is a good discussion, is, you often hear about men and women in their 60s who are doing marathons and Ironmen. And every once in a while, some of these people who are taking really good care of yourself overdo it. And then they present with conduction system abnormalities like atrial fibrillation, or maybe even a stiff heart, what we call diastolic heart dysfunction. I guess that's because they push themselves so far that they can't repair themselves well and start developing consequences of that, right?
Yeah, I'm not sure that we really know, but I think what you're saying is likely. We're a little bit concerned about too much oxidative stress. And sometimes you would be very surprised that the coronary arteries of some of these extreme exercisers. Now, I'm not talking about elite athletes. I'm not talking about elite athletes. They're a different breed. They are not us. Sometimes these coronary arteries don't look so good, and you would think, well, they're going to have the greatest coronary arteries in the world. So I think, like everything in life, it's a little bit dose dependent.
Yeah, yeah. But there certainly are a lot of people in their 60s who have exercised consistently who pop up with AFib, right? Atrial fibrillation.
Yes. Yeah.
Yeah,
Well,
that
I
happens
think
a lot.
that might go to the stiffness. But, flip side of that, because I really want to promote the value of this, which is far and away the greater value, is tell me if you've seen this, but I have a number of patients, diabetics, and I'm talking about juvenile onset or early onset type 2 diabetics who have been fit and exercised a lifetime, Harry, who have taken statins, another subject, but they've got an LDL of 55. They've exercised their entire life. They're trim and fit, and they've been taking insulin their whole lives. And in some of these people, I know what their coronary arteries look like. They're fantastic. It's amazing. Because the old saw in cardiology was, well, if you had that, you had coronary disease. No, they don't. Not necessarily. I think that regular exercise is underappreciated. I think regular exercise is more of a plus than smoking is a minus. Now, don't get me wrong. Of course, we're 100% against smoking, but people underestimate a good fitness program in terms of mortality reduction.
Yeah, I think you're right. Getting back to the people who develop AFib, high volume exercisers, they're probably not doing zone 2 training. Probably not. They're probably doing oxidative stress training.
Yes.
Yeah. And I think about some of these, I'm sure you've seen these patients too, some of the Ironmen people,
Yeah.
I mean, just pushing it and pushing it. So it's a little bit of something is good. A lot of it of something may not be so good, or the Goldilocks theory, not too much, not too little, just right.
And just between you and me, we know these folks, and they're always a little crazy.
Yeah. Yeah. And then I do want to make a comment about if you're following your heart rate, when you're in zone 2 and you're in it for a reasonable period of time and you're keeping up a steady pace and you feel good, it's normal to see, if you're following your heart rate as you're getting towards the end to start going up. Yes. Cardiac drift.
Yes.
And then that's when you have to back off. You have to really find the discipline to say, okay, I'm going too fast. I got to back off, even though I feel okay, and bring it back to where it feels more comfortable. And that's how you're going to get all the value of the mitochondrial flexibility and, improving your mitochondria and maybe making new mitochondria and getting good efficiency.
Right. I completely agree. And, athletes need to sort of take their temperature every day. And by that, I mean, how do you feel today? Not every day is your best day. That's okay. If you feel well enough to exercise and you realize, I maybe got a little fatigue, take it a little easier. You don't have to. That's why I like the notion of feeling how you feel even more than I like watching your heart rate. Plus, this is supposed to be fun. If you're a heart rate guy and you got to wear that heart rate monitor all the time like you do, I don't need that. Just go out and feel good, try and stay in a good zone and be happy.
And I don't use the heart rate monitor all the time, particularly when I'm outside. I just concentrate on my breathing, which gets me through it. But I do think people need to also know the warning signs of overtraining when they're pushing it too much. Fatigue, your muscles feel bad, your joints feel bad, you're less enthusiastic about training, your motivation lags, and you're probably overtrained and you need to take a day or two off.
Absolutely. Absolutely. What do you think about nutrition, Harry? You're much more knowledgeable about that than I.
I think that actually something that I didn't realize a couple of years ago that I think is important now as you age is you have to get the right amount of protein. As a rough indicator, you could say a gram of protein per kilogram of you, right? So if I'm 70 kilograms, I want to try and get 70 grams of good solid protein, which I think really helps, maintain your muscle mass, because your muscle mass is going to decrease by about 3 to 5% every decade. And this is one of the other reasons why it's so important when you have your program that you're really doing some resistance training. There's the natural aging phenomena of losing muscle as you age. So if you want to keep up your muscles, you got to do some resistance training. You got to get adequate protein. I think there's a group of people that get too many carbohydrates, too much fat, and not enough protein. And it's got to be good quality protein. And you get it from plants too. There's plenty of good plant protein. So I think people ought to sort of focus enough about that. A lot of people get too much protein, and that's stressful for a variety of organ systems like your kidneys. So you want to be careful about that. I also think that when you do zone 2 training, there's some value in training fasting, because when you're fasting, the first thing that's going to happen is you're going to get rid of the glycogen in your muscles and your stored sugar in the muscles and in the liver. And then pretty quickly, you're going to start getting into your fat stores and aerobically burning fat efficiently. I tend to, when I do zone 2 training, I'm fasting. I usually run in the morning or bike in the morning, and I'm fasting. And I think I'm getting the best out of actually breaking down and getting good access to my fat. And everybody's got a lot of fat that they could lose. This has been a terrific discussion. Ron, it's been my pleasure to have you here as our guest. And thanks to our audience for listening, and thank you to the Columbia Association for sponsoring Finding Your Wellness. You can listen to all of our podcasts from Finding Your Wellness by typing into your browser findingyourwellness.podbean.com. Thanks again. This is Harry Oken.